All right, hello and good afternoon, everybody. My name is Dr. Jessica Collins. I'm a foot and ankle surgeon, a podiatrist, and today my lecture is titled Foot Form and Function, How Foot Type Relates to Ankle Pain. Before I start, I also want to just say thank you to everybody for attending. I always commend patients and everyone really for, taking education into their own hands and being interested in medicine. So thank you again. So topics I'm going to discuss today, I'm going to give you a little bit of background information. I'm going to discuss two main foot types, which are the cavus foot and the planus foot. Over here on the side, there's a picture which shows pronation and supination, and I'm going to go into detail about that. But what I just want you to appreciate about this picture is this is looking at a foot from behind, and you can see how when there is any foot deformity, there is extra pressure that's put on the ankle here. I'm going to discuss the relationship to ankle pain. As I mentioned, I'm going to talk about some protection and prevention methods and techniques for patients and also some treatment options. So everybody may be asking themselves, what is my foot type or what is a foot type? Foot type can be classified by your arch height. Your arch is your instep. It's the inside of the foot. We typically observe a patient clinically, meaning looking at them, looking at their arch height when you're standing, when you're not standing, and then also this is assessed through radiographs or x-rays. A high arch foot is known as pes cavus. That's a higher arch or a high instep versus a low arch or a fallen arch, which is pes planus. You might ask yourself after you kind of think about what is my foot type, why is my foot this way? How did my foot get this way? And what's really important, and the reason I included this picture, is just showing that we all have a genetic makeup. We all have a genetic program, and our foot is really related to our genetics. You're born with your foot. However, there are influences that are outside forces, which can definitely impact our foot. They can change our foot measurements and change our foot type overall. So genetics, everybody has a flat foot early on. There's a saying we say in our field that babies, they have flat and floppy feet. That's completely normal. When you're born, you do have more of cartilage in your feet, not so much hardened bone. And because of that, the feet are really pliable. And you can imagine if you have something that's soft and pliable like cartilage, then outside influences such as shoes, which you can see these cute shoes here, you can see this baby's feet, and you can see how these shoes are probably a little bit on the big side, but you can imagine when you have a soft surface and you apply something on the outside, that can definitely affect the development of that foot. Typically, your foot is the shape it's going to be, the arch height, it's going to be at around the ages of 12 to 15. That is not a hard and fast fact, but that is something that you could expect, that your foot is likely going to be the size that it's going to be and the shape it's going to be around that age. Footwear is very important for protection. It's essential, right? We don't want to step on anything. You don't want to stub your toes. You don't want your baby to stub their toes. However, like I said, the shoes that you wear can definitely lead to a deformity in the foot sooner or even later in life. So a little bit of a closer look here at the cavus versus planus that I mentioned. I am going to use some different terms here that are here for completion's sake, and I'm happy to go over anything after this lecture if there are any questions anybody has. Flat foot is something that is incredibly common. I would say even more common than the cavus foot or the high arch foot. It is associated with motion that is known as pronation. We have three cardinal planes that our body creates motion in and that we move in. And when you're a pronator, the three movements that are happening are dorsiflexion, eversion, and abduction. Again, this is maybe a little bit much for the sake of this lecture, but I just wanted to include it for completion's sake. So I don't mean to overwhelm anybody by getting really biomechanical. I just wanted to include that. There are many different classification systems out there. There are many ways that we classify feet, whether it's by looking at the feet, by x-rays, by foot imprints, you can see here. But the reason I wanted to include this is showing what a foot pressure point drawing looks like on a normal foot. When you have a flatter foot, you can see as that foot flattens out, you obviously have way more pressure and you have a lot of pressure on the inside of the ankle there. With both a high arch foot or a flatter foot, The deformity could be flexible, meaning you can move it. So if you were seated, perhaps it looks like you have an arch, but when you stand up and you put weight down, then that arch flattens out. That's what we call a flexible deformity. When you have a rigid deformity, that's when you're seated and standing and that arch is remaining at that same height. Oftentimes, like I told you, you're born with that flat foot, that fat, flat, and floppy foot. However, that doesn't mean you're going to have a flat foot forever. A lot of times that arch will normalize and you can actually flatten out later in life. When you are a pronator where you do have a flat foot, you favor the medial, which is the inside portion of your foot or ankle. And you can see that here. This is the inside of our foot here, and that you put so much more pressure on the inside there. If you were looking at an x-ray, which is very important, I always tell patients, if you're ever going in for a foot assessment and ankle assessment, it is always important to get x-rays because you can only see so much by checking out a patient, by looking at a patient, checking their foot, watching them walk. It is important to look at the bones in the joints. And on an x-ray, the heel bone actually has a decreased incline to it, which makes sense because that arch is fallen, so that heel bone is going to be at a decreased incline. Here's that x-ray that I was mentioning. You can see this is the heel bone. This is a pediatric x-ray. That's why you see these growth plates right here. But this heel is just completely flattened out there. When you have a high arch foot or pes cavus, that is associated with the motion called supination, which is plantar flexion, pointing down, inversion, and adduction, pardon me. When you have a high instep or a high arch, this picture demonstrates this pretty well. Looking at the foot from behind, you favor the outside of the foot there. So if you're somebody that, you can pick your shoes up and look at them, set them on the table, look at them from behind, and it looks like it's worn on the outside, then you likely have a higher instep. If it looks like it's worn on the inside, then you likely have that fallen arch and a flatter foot. A lot of times when you have this higher arch foot, there is an associated neurological disorder. That is just something that I wanted to include too for completion's sake. There is a neurological disease called Charcot-Marie Tooth, which is associated with that high arch foot, but you don't have to have any neurological issues to have a high instep because there are those genetic factors. Somebody down the line, mom, dad, grandma, grandpa had that foot type, I assure you, and that's how you ended up with that. So here's just a side-by-side comparison of a flattened arch to a high instep, and you can see that pitch of that calcaneus is higher, the incline there is higher versus when you have that flattened out kind of pancake foot. What is the association here with the ankle? So I like to talk to patients and draw this out actually, what I call the pain cycle. So ultimately there's some sort of deforming force that's there. That is the foot type that you have, that is shoes. And what happens is when you have any deforming force, you end up having inflammation and subsequently you have pain. When you have pain, you walk differently, your body compensates, and that further is a deforming force, makes more inflammation, and the pain continues. When you have a higher arch versus a flatter arch, how does it affect the ankle? When you're a supinator or you have a higher arch, you lean on the outside of the ankle. So you're putting so much extra pressure here on the outside there. When you have that flattened arch, you're putting all your pressure on the inside there. And that's important because the structures that are located in these areas are going to be the ones that are affected and are going to relate to your pain. The tendons in our foot, they actually start as muscles, which come from the leg. And so they pass around the ankle. And it isn't uncommon to have pain that translates all the way up the leg because everything really is connected. So when you have a deforming force over time, you're leaning outwardly on the ankle. You have that high arch foot type. The ligaments that secure that joint start to get longer and looser over time just to accommodate for that. And that leads to what we call joint instability. You get overuse and wear of the soft tissue structures around that area because, again, you have that pressure, that deforming force that's either forced on the inside or the outside of our foot and ankle. What this results in typically is tendinitis or inflammation of a tendon or arthritis, and that's inflammation in the joint itself. This was a picture that it shows the main structures affected by foot pain. Really, that is more so related to the inside and the outside. And this was really just more for completion's sake. And then this is indicating the outside of the ankle. There's a joint there that is often affected when you have extra pressure on the outside. So again, two pictures here that I included just to show the different areas of our body and where we tend to have ankle pain. When you have that fallen arch, if you will, that lower instep, you're putting all of your pressure on the inside, and that's really causing some bowing, some inflammation and pain in that tendon. It isn't uncommon to get pain in the ankle that then goes all the way up into the leg. Alternatively, if you have that higher instep, you have pressure on the outside of the ankle, and same thing, it's just different anatomy here, but this is where our peroneal tendons are. And same thing, if you're leaning on the outside of the ankle, you have a lot of extra pressure here along the peroneal tendons, and that can translate into peroneal tendinitis. Also here, I have just another picture showing the anatomy here of the outside of the ankle versus the inside of the ankle. And the reason I really included this was because you can see these structures around our tendons, and those are called tendon sheaths. So all of our tendons, they help our ankle and our feet move and glide and move around. And in order to do that, it's important to have a cushion and a lubricated surface to do that. So tendons have tendon sheaths that help us do that. When a tendon passes a joint, you have to have some sort of lubricant, some sort of, if you think of like an oil, if you will, to keep those joints from squeaking. That's a kind of a good way to think about it. But if you have extra tension on the outside of the ankle or on the inside of the ankle, you get inflammation inside of these areas there, which translates to pain, and you walk differently. You have those deforming forces I mentioned, and that cycle continues. So having a planus foot versus a cavus foot, this was just something else I wanted to mention here. When you have a flattened arch, you often are associated with that inside pain, but not just the inside. Also, the outside of the ankle can hurt, but not because, or pardon me, for the same reason. More so because of this picture here, which is an excellent picture. I was glad I found this. But this is somebody that favors the inside of the foot. So you can see how the foot's kind of rolling in, the little toes kind of elevated right here. And you can even do this right now for yourself. But if you put your foot on the floor and just rolled your foot inward, you can feel that the outside of the ankle here gets pinched. So there's a joint that's right below our ankle joint called our subtalar joint, pardon me, and people who have a flat foot very often end up with sinus tarsi pain or what's called lateral ankle impingement because of that pinching. In the same respect, just in relation to anatomy, if you have a higher instep to your foot, that puts a lot of tension on the front of your ankle. And in that same way, you get impingement at the front of the ankle, and also you can get pain in the structures that glide across the front of the ankle. So, once you have assessed your foot type and, you understand your foot type, you understand a little bit about where the extra pressure is, how it's affected the ankle, meaning you're rolling in, putting more pressure on the inside of the ankle versus out, more pressure on the outside of the ankle. Then, you might be asking, so now what? One thing I'm actually going to backtrack just really quick because I wanted just to mention here is that in both cases of the flat foot and the high arch foot, there is always extra tension on the back of the ankle along our Achilles tendon. So in both cases, you can certainly get Achilles tendinitis. The calf is just such an important muscle structure. It is responsible for pushing off when we're walking. That Achilles tendon is the strongest tendon, and it's just when there's a deforming force there, the whole foot is going to feel it, the whole ankle is going to feel it, and even translating up to the knee and the hip. So Achilles tendinitis is something that is very commonly associated, in the flat foot, but also in the cavus foot. So what now? Now what, if you will, protection and prevention. So this here, foot protection must be worn. Yes, I tell that to all my patients. Shoes are very important. If you don't have shoes on, and you're somebody like me, I grew up in Florida, I grew up in flip-flops, so I definitely can relate to people and walking barefoot pretty frequently. But as we get older, as you're growing through life, as our body weight increases, as your bone density increases, when you're walking barefoot, there's just really not much shock absorber between you and the ground. So you really feel that in your joints, and it's not something that you necessarily feel right away, but over time, that deforming force definitely leads to inflammation, it leads to walking differently, it leads to structural differences, and ultimately pain and discomfort. So education, important. It's why you're all here, to understand and know your foot type and what risks you have for that foot type. shoes. I get asked the most questions, I would say, about shoe gear, what shoes to wear, and orthotics. And shoes are key. Shoes are so important because if you have a good shoe, that can certainly fix a lot of issues. It can certainly alleviate pain. If you have a bad shoe, it can do quite the opposite. Orthotics are something that I make for patients. I also script out patients to get orthotics if there's something really specialized that's needed from some of our local orthotists here that are specialists in making orthotics and shoes and inserts. Not all orthotics are created equal. There are over-the-counter orthotics versus the custom ones that I mentioned I make or orthotists make. And there's a lot of literature out there and a lot of controversy on the internet if you were to do a Google search on this, on what you should use and what works for you and your foot type. I always encourage you and patients just to follow up with your local foot doctor. Come see me, because there's a lot of things that need to be done in person to kind of investigate your foot type and what works best for you. But overall, if you look at comparisons of an over-the-counter orthotic versus a custom orthotic, in a lot of patients, an over-the-counter orthotic is pretty great and it can work really well. But the problem is not all over-the-counter orthotics are created equal. I certainly don't mean to say anything bad about Dr. Scholl by any means, but there are a lot of Dr. Scholl orthotics out there that sometimes it can be a little bit confusing, and you buy it and it's supposed to give you, some support, and then maybe it's more of a cushion. So, it can just be confusing. There's a lot of stuff out there in the foot sections at our department stores. So I always encourage patients just to come in. You could always bring orthotics. I'm always happy to show patients where they can obtain good orthotics, if not from us. It's all about moderation. So I am definitely a physician who tries to emphasize to patients that moderation is really important. You can certainly wear your favorite shoes. You can wear heels. You can wear, your narrow fitting boots and your high heeled boots, but you don't want to do that on a daily basis. You don't want to do that on a weekly basis because it's going to cause more pain and then it's going to lead to dysfunction, as I mentioned. It's also important prevention-wise to exercise, and physical therapy is quite important as well. I wrote here musculotendinous balancing, and I'll talk about that a little bit more, but ultimately it's about balancing out the muscle groups. If you are somebody that rotates in, or you have a flatter arch, or you rotate out and you have a higher arch, then you can imagine the opposite side is going to be perhaps a little tighter or a little weaker. And so by balancing that out, you can certainly prevent and protect your body. So this was a good picture that I certainly appreciated and wanted to include today, showing where the foot strikes and where shoes wear away, if you will, when you have a certain foot type. So a supinator who favors that outside of the foot versus a pronator who favors the inside of the foot. The reason I wanted to show this is because I do encourage you to look at your shoes, look at some of the shoes that you wear the most. And, like I said, put them on a flat surface, look at them from behind, look at them on the bottom, and really see, are you wearing away on the outside of the heel? Are you wearing away more on the inside? And then from there, that can help you determine what type of foot you have, and also how to correct the problem with outside devices such as cushions and lifts and orthotics. Not every foot is the same. So on one shoe, you might favor the outside. On the other shoe, it might be the inside. And, there's a lot this lecture could go on for a long time just talking about all the different deforming forces there. But, it's not necessarily something to be incredibly alarmed about if one shoe is wear differently than the other. It's just helpful in knowing, how to change your shoes and how to accommodate for that. It's also important, I should note, that if you are going to come in and see me, or you're going to go see a foot and ankle doctor, that you do bring shoes that you wear very often, because I always assess shoe gear when somebody has a foot deformity and they have ankle pain, because it's important. I love to educate patients and show you exactly what I mean. They're live action. So I do encourage you to do that. Also, if you have any inserts that you wear regularly, you should definitely bring those in as well. So this is the parts of a shoe. There's actually a lot of pictures online if you look at the anatomy of a shoe, but not all shoes are created equal. It is important to have some support, and typically that's on the medial side or the inside arch support there. It's also important to assess how deep that shoe is. If you have a shoe that isn't very deep, you can imagine that you're not going to have any ankle stability. When you think about how a shoe is made or what your shoe is made out of, a lot of times the newer shoes, they're really this soft, breathable material. They call it a low profile around the ankle, but that's not giving you any support at all. So if you have a flat foot, perhaps the bottom of your shoe is very helpful. You have a really solid arch support in there. You have a solid shoe that's giving you some structural support. However, the material on the outside of the shoe here around the ankle, if that's just something that's loose, your ankle's going to continue to roll in and you're going to end up having ankle pain. So something with some more depth to it is definitely important. You can get both the foot and ankle support in that way. Shoes specific for your foot type. So if you have ever gone to a specialized shoe store, if you decide to do so, if you go to perhaps the New Balance website, here's a New Balance, Saucony, Asics, any of those really popular sneaker brands, you'll see a lot of times on the website, they break down their shoe styles based on your foot type. They'll say either a pronator or an underpronator, which is also known as a supinator if they don't say supinator. And, there are special shoe structures for your feet. You have to be very careful with that because it's not always what you expect. You certainly can get overcorrection and undercorrection if you do that, because perhaps, in not truly understanding your foot type, you may very well have a shoe that was maybe meant for a supinator, and maybe you really aren't supinating very much. And now you're going to have a lot of extra pressure and it's going to make you very uncomfortable. So I do find that it can get very confusing and very complicated when it comes to, which shoe to pick. And the safest thing to do actually is a good walking shoe. A walking shoe tends to give you a really neutral ankle and a neutral foot. So just a standard walking model. It doesn't have to, if you're a runner, you might think I need running shoes. Not necessarily. A good walking shoe within many different brands is actually, very supportive typically, and it keeps you at a more neutral position. And you're not as worried about that over and under correction. I mentioned that you can also get support from external support. That's like an orthotic or a sleeve or an ankle brace itself. This picture down here shows how when you're in the right shoe, you get better correction. So this shoe here, you can see how the ankle's still rolling inward here, and that's because of the material that the shoe is made out of. These shoes are, or a lot of times, even myself included, I find I'm attracted to the new shoe, the stylish shoe, if you will. They come in bright colors and, they're very fashionable. But a lot of the newer shoes that are coming out that are the more fashionable, lighter shoes, they just don't have any support. And so, they might last you a lot less time than a bulkier shoe, if you will. But, is it worth it? It's just something that you have to assess and you have to think about and then also discuss with your physician. I mentioned before, it's all about moderation. High heels, I put a lot of dots there because I know, some people are married to their heels, they love their high heels, and I definitely do not want to tell somebody you can never wear those again. It's about moderation, and it's about understanding, the forces that happen when you're in a high heel. So if you have a normal arch height, if you will, perhaps you won't feel it as much. If you already have deforming forces such as a really low arch or a really high arch, it's just adding to those deforming forces there. Okay, I said try to keep it to 2 inches or less. I know some people would say that's not even a heel, but that is a good rule of thumb. Heel shoes, they cause contracture of the Achilles tendon because this is the ground down here. This is where your toes are. So that heel is elevated 2 inches or more, let's say, so that Achilles tendon is going to be shortened. When you come out of the heel and this heel bone goes back down to the floor, that's going to cause a lot of tension and a lot of pressure on these structures around the ankle, and is going to lead to some deforming forces and tendinitis. Achilles tendinitis is a big factor I mentioned, but tendinitis around the ankle entirely. Narrow fitting shoes are also something that, a lot of times, and I'm a female, I wear women's shoes, women's dress shoes, but dress shoes in general tend to be really narrow, and that puts a lot of pressure around the toes and the toe joints. And how does that affect the ankle? Because if you have extra pressure around the toes, if you have extra pressure around the foot, you ultimately are walking differently than if you were in a more supportive shoe. And when you have that extra pressure, you walk differently and you get extra pressure at the ankle, you get deforming forces around the ankle, then you get inflammation and pain as that cycle is that I mentioned before. Compensation, I put with a little exclamation point there, and that's just because our body, the way our body functions, I'm sure everybody's kind of heard that song that the hip bone's connected to the knee bone and the knee bone to the ankle, and that is exactly right. Because joints are mobile structures, we are mobile beings, we walk around, the joints, they move together, they compensate for each other. So if you have any issues in the foot, then you're going to translate that to the ankle, you're going to translate that to the knee, and then to the hip. Ultimately, the back, even the neck, the shoulders can be affected. So orthotics, I included this picture because you can see there's so many different types of orthotics out there. There's so many different materials that they're made out of. You can get an over-the-counter versus a custom orthotic. There are two words you may hear if you ever look into orthotics, if you saw an orthotic specialist, an orthotist, and that's accommodative and functional. An accommodative orthotic is something that's accommodating. It's giving, it's decreasing some pressure, it's giving extra cushion, versus a functional orthotic is giving correction. So a functional orthotic tends to be more rigid. It tends to have something plastic there, which can be cushioned off, but it has more structure to it in order to give your foot more support. I wrote cushion does not equal correction, and that's exactly right. That statement, I can't emphasize that enough. If you were to get a cushioned over-the-counter insert, a gel cushion, for example, or a heel cup, it might feel good at first, but it's not doing much for you after a few steps. It's not correcting the issue. An orthotic itself can be partial or full length, okay? And that's really patient preference and sometimes physician preference. I added here that orthotics are not typically suited for dress shoes or heels, but there are orthotics that can be made to go into dress shoes or heels. So you can get a narrow fitting, a low profile orthotic made, and they do sell some that are over the counter as well. There are many different materials that orthotics can be made out of, and they're not all equal. And so that's also something that's really important. I've had patients that have come to me and they had custom orthotics made and they cost hundreds of dollars, or maybe their insurance covered them, and they hate them and they won't wear them because they're so uncomfortable for them. And that's the last thing I want, is to put something or put somebody into an orthotic that is going to worsen their condition, if you will. So there's a lot of things to consider when making orthotics for a patient. I always discuss with the patient the different materials that orthotics are made out of, the different foams and the coverings over the orthotic, because that makes a difference. The hard part of the orthotic, the structural portion of the orthotic, is typically made out of some plastic polymer, some mix of plastics, or also graphite. I do use graphite orthotics, and cork is another material that can be used, and different densities of foams can be used. Leather is typically used to cover the top, not so much the structural portion of the insert, but foams and plastics, cork, all of that can also be incorporated into the top of the orthotic, which is known as the top cover. The orthotic itself, the hard part, the structural part of the orthotic, if you will, definitely should last quite some time. The top part of it, though, the cushion part of it, wears away with use, and you don't always have to get a new pair of orthotics. You may just need to get them refurbished, it's called, and recovered. I also get a lot of questions about that. You know, how long will my orthotics last? You know, when do I need new orthotics? How do I know if I need new orthotics? And typically it's just like a pair of shoes. You look at your orthotics, you assess your orthotics, and you can see the wear on them, and if you do need a new pair. So now what? What do we do now that, you know, we know our foot type, we have ankle pain, you know, we have maybe some foot pain. What's next? I have tendinitis, I have arthritis, I've covered that now. I perhaps tried some protective measures and some preventative measures, but ultimately, you know, my genetics got ahead of me, and I have foot pain and I have ankle pain now. So treatment. Conservative measures should always be considered first before surgery. There are some things that you can't really argue that with, say a fracture, something that just requires surgery. But for most of the things that I see in my profession and I treat, there are many conservative options to keep you out of the OR. Price therapy is really important. Price therapy is a general treatment algorithm that can be applied to many different things. It can be applied to general itis, so that's tendinitis or arthritis, inflammation somewhere, and it can also be applied to an injury. And what PRICE stands for is protect, rest, ice, compress, and elevate. So resting, you want to obviously take some time off. Say you were in some uncomfortable shoes or you went for a hike, and whatever the case is, and you have ankle pain now, you have to rest it. I know that's hard for a lot of people because we have to get up every day and go to work. People have kids and pets and just things that require us to use our feet every day. So it can be hard to rest, just depending on your lifestyle, but rest is really important. Ice is something that helps with inflammation. Ice tends to be the most beneficial within the first 48 hours after experiencing pain. However, ice can help for long term. And if it's something that's making you more comfortable, even by just numbing the skin, then I recommend using it. Compression is important for helping with swelling. Unfortunately, if you ever have any issues in the foot or ankle, swelling is just always something that accompanies that, and that's just our bodies. That's gravity. The toes are the very farthest thing from the heart. Every day you get up, you stand up, blood rushes down to our feet and our ankles, and swelling is just something that we're always combating. So having some compression helps, and then elevation helps with that as well. Other treatment options or treatment methods that are really important when you have any pain or any inflammation. And I should note right now that prior to just starting these treatments on your own, I definitely encourage you to come in and see me or consult your physician. But if you do have any generalized pain, if you have arthritic pain in the joints, if you have any tendinitis, then certainly anti-inflammatories outside of just that topical icing are indicated. And anti-inflammatories include the non-steroid anti-inflammatories, and that's medications such as ibuprofen, Aleve, Advil, all the names for those, and then steroids. Steroids are medications such as prednisone, which are very potent anti-inflammatories. Oral medications are typically a first-line treatment when you have inflammation and you have pain. However, there are also injectables. There are injections that can be given of the steroids, which sometimes is a lot safer for a person. Instead of taking an oral steroid, which goes through our bloodstream and battles the inflammation that way, sometimes injecting that medication directly at the source of the problem is what's most beneficial. There are also biologics, or I just included this more so for completion's sake, but again, I'm happy to discuss any of this after this lecture here. But biologics are things such as platelet-rich plasma, which is demonstrated right here. There's also amniotic injections, and really what those are doing are providing growth factors. They're providing anti-inflammatory factors. The unfortunate part of that is that because there is some controversy in the literature and just overall, insurance typically doesn't cover those treatment options. There are some great products out there that can certainly help with treatment of generalized tendinitis, of arthritis, but that is something that I included on this list, and I just like to let patients know that a lot of times that stuff isn't covered by insurance, but it's certainly an option to try, and I've seen great results with both of those therapies. There's also a treatment which is non-surgical called tissue stimulation, and this is two examples of that. There's extracorporeal shockwave therapy, sometimes known as EPATs as well, but it's shockwave therapy. What it is, and this is a picture of it, it's literally delivering a wave frequency to the tissue that helps break up scar tissue, it helps break up inflammation, and our tendons, they're made of collagen fibers. And I always try to explain to patients that if you took a tendon, the tendon's a round structure, and you cut it in half and you looked at it, it would look like a rope, like if you think of a thick braided rope. And there's fibers there, and that's made up of collagen fibers. And when you have any deforming forces, when you have any inflammation, those collagen fibers get disorganized. And so what this stimulation can do is it can help reorganize collagen, it can help break up scar tissue, it can help stimulate our bodies to come in and heal and repair where inflammation is. Same thing with a technique known as dry needling. Dry needling is exactly as it sounds. It's a needle and you're going in dry. You're not injecting anything, but you're poking repetitively along an area of inflammation, typically a tendon. And in doing that, you're stimulating your own body to go in and bring healthy tissue, or bring healthy blood flow, pardon me, and growth factors to that tissue to help stimulate healing. And you can imagine it is not the most comfortable technique, neither of those are, but it is certainly an option, and there are measures that we take to make sure that your pain is well controlled. Exercise therapy, physical therapy. I mentioned this before for prevention, musculotendinous balancing, pardon me, and that's strengthening adjacent muscle groups. So if you're somebody that is a pronator and you're rolling in on the instep on the inside of your arch, you can imagine that the structures on the inside are getting bowed and stretched out and they have chronic pressure. The structures on the outside are getting tighter, if you will, and pinched. And so balancing that out through physical therapy techniques such as stretching, also formal physical therapy where there are different techniques that are done to help with the muscle tendon balancing, pardon me, and that's deep tissue massages, ultrasound. There's a technique called Graston technique, which is a type of aggressive massaging that helps break up scar tissue and inflammation. But ultimately, you can live with a deformity. You can live with a structural deformity where the inside, the outside of the foot or the ankle is maybe favored by strengthening the surrounding structures. So when conservative treatment fails, surgical intervention should be considered. And I mentioned that if, conservative measures such as the things I mentioned, NSAIDs, anti-inflammatories, price therapy, changing your shoes, trying orthotics. When that has failed and you've gone through therapy, then there's always surgical intervention. Surgical intervention can entail arthroscopy, which is taking a camera and looking inside of a joint. By doing that, you can clean up any inflammation inside of the joint. You can visualize the joint, see the extent of any arthritis that's present. You can also, through there, repair any cartilage defects that are noted. And then there's also even joint replacement. We do total ankle joint replacements, which is something that I find not a lot of people realize. A lot of people are aware of knee replacements, they're aware of hip replacements, but there are also total ankle joint replacements. And that is just a really neat, excellent technology that has come out in the recent past. It's been around for many years, but it has advanced, and the technique that we use in our practice is a CT guided technique, and it's more patient specific, and that is something that I would be very happy to talk to anybody about. And you're always welcome to come in. My colleague and my partner, Dr. Rudolph Zach, he's another foot doctor in our group. Both he and I do ankle joint replacements, and we're happy to talk to you anytime about that. Other than that, there's also things that can be done to address the tendons directly. That's stabilizing those tendons. There are things such as even tendon transfers to help stabilize the ankle. But really what happens when you have extra pressure on the inside, the outside, the back, or the front of the ankle is these tendons, which are tubes that glide around our ankle that help our foot and our ankle move together, they stop becoming these round structures and they flatten out. They don't typically tear end to end like this, but instead they roll out and flatten out. And when that happens, you just have continued deforming force, continued inflammation. So surgically, you can go in and you can clean up inflammation around the tendon, and you can make that flat tendon into a tube again so that it can glide around the ankle. So to summarize, foot type can be classified as by your arch height, pardon me. There's that cavus foot, the high instep. There's the planus foot with the low instep. Arch height often relates to deforming forces onto the ankle. This leads to pain and then ultimately pathology, such as arthritis and tendinitis. Protection and prevention is key in preventing this pain and future problems. So knowing your foot type, knowing how you're wearing away on your shoes is very important and essential. Orthotics are really important. The shoes you wear, as I mentioned, are really important. And then I just wanted to finish by just reminding and repeating that conservative treatment should always be considered first. Surgical intervention is always an option. Before surgery should be considered, definitely considering the conservatives such as changing your shoes, orthotics as mentioned here, injections, anti-inflammatories, and then exercises and physical therapy. So that is the end of my lecture here. I just, again, want to thank you all for your time and attention tuning in here over lunch. And now I want to just take the opportunity to do some questions and answers. First question here, which is, are there certain brands of shoes you recommend dependent on high or low arches? So with all things considered, and not to pick on any brands by any means, I will say that I find that Nike in particular tend to be a very narrow shoe, and they tend to not have a lot of depth to them. So that being said, any shoe brand that's out there can work for a high arch or a fallen arch foot because you can always incorporate an orthotic in it. However, if you have a shoe that doesn't have a lot of depth to it and you add an orthotic to it, you're going to have ankle instability because you're now elevated in that shoe. And then also when you have a high arch to your foot, you already tend to have some pain and extra pressure on the top of the foot. And so when you add something else in there, it just makes it even tighter on top. So brands wise, really good brands that have good models in all of the shoes, or all of the brands rather, have good models within them. But New Balance traditionally has a lot of options. They tend to have more depth to their shoes, and they tend to accommodate for both the high and the fallen arch foot. Saucony, some people say Saucony, it's Saucony. They also have a lot of good, they have variety within their shoes that has a good walking model, but also a good flat foot shoe and a good supinator shoe. Also Brooks is an excellent brand for both the high and the lower arch foot. So I think I missed this first question. Are orthotics covered by insurance? So orthotics typically are covered by insurance, but I say that I don't want to say all insurances by any means, but what we do within our practice is we see you for an initial visit, we assess your foot type, talk to you about all the different options, show you some good over-the-counter options if that is something applicable to you, and then we prior authorize it with your insurance. So a lot of times patients are really surprised the insurance does cover orthotics because a lot of them do. Medicare does not typically cover orthotics, and that is something that I think is frustrating just across the board, because a lot of patients could benefit from orthotics, but Medicare tends to only cover them if you are diabetic. The only way to find out is if you call your insurance, or you could always come in and we could prior authorize your insurance for you. So next one, are orthotics only recommended for people with issues or anyone? So orthotics, I would say are not recommended just for everybody. If you don't have any foot pain and you're not having any issues, then orthotics are not, necessarily needed, because if you put something in your shoe, and that can certainly throw your gait off, it can cause more deforming forces. So if something, there's that saying, if it's not broke, don't fix it. That's kind of what I would go with that. But having the orthotics though as a preventative, I definitely am a supporter of. So if you don't have pain, however, you do have a really flattened arch or a fallen arch or a higher arch, then I do think orthotics can help as a preventative. Next question. If you have been using the wrong shoes for years and then end up buying good, appropriate shoes for your foot type, will those new shoes cause you pain at first? Potentially, yes, that is the case. I like to try to tell patients, you've had this foot your whole life, right? And you've had this foot structure. You've been going along for as long as you have, wearing this certain type of shoe. So getting into a shoe that's more corrective for you initially might be uncomfortable. I find that the biggest reason that patients don't like orthotics or like more structured shoes are because they're painful. And with that, it's just really important to incorporate them over time. So if you have a shoe that's better suited and more structured for your foot type, then you just have to break it in over a 1 to 2 week period. So is it not good to wear sneakers all the time? My twin boys only like to wear sneakers. They only wear shoes when they dress for church or special events. However, lately, since the pandemic, they've only been wearing sneakers or their Nike slides or UGG slippers in the cold weather. Can this cause issues in the future? Wearing shoes all the time, it's kind of a dynamic question to answer. It's not the most, straightforward answer that I can give you. Wearing shoes all the time, does that cause problems? Not necessarily. If they're ill-fitted shoes or shoes that, are not good for your foot type, then certainly they can. It just depends really on their foot type, on, if they're favoring the inside versus the outside, the front versus the back, how they feel in their shoes. If their shoe has any like heel to it at all, then that definitely can affect things and cause some issues later on. Slides and UGG slippers, they just aren't very supportive at all, but they're definitely better than nothing. And I encourage patients, and especially the younger kids, I say, just have something on, have a slide on, have something on, and that can just give you protection. So it's about protecting your feet, but also preventing issues in the future. I hope that somewhat answers the question, but as long as the shoe is fitted appropriately, as long as it's not causing any, deforming forces or pain, then wearing, sneakers should be absolutely okay. What happens when teens wear shoes that may be too big? How close to their toes should the shoe actually be? I've always used the top of thumb line as a measurement from their toe to the tip of the sneaker. So that is actually an excellent way to measure. I was going to say you use your thumb and you touch where the tip of the toe is and see how much space is there between the tip of the toe and the front of the shoe. A thumb's breadth, it's called. You definitely want at least a thumb's breadth. If you do any research at all on shoe size, you may find that the recommendation is to go at least a half size bigger than what your measured shoe size is, and that's because throughout the day our feet swell. And so you don't want a shoe that fits just perfectly where the tip of the toe is just touching the edge. You definitely want at least a thumb's breadth there, a thumbprint there between the tip of the toe and the tip of the shoe. If a shoe is too big, that certainly can cause problems, because what happens is you slide in the shoe and it causes bumping of the foot towards the front of the shoe there. And it also causes ankle instability. So wearing shoes that are too big are definitely not recommended. Just the same as shoes that are too tight. Some people may argue, it's better to wear a bigger shoe than a tighter shoe. It just depends. It depends on their foot type and other factors. But as a teenager, it depends what age they are as well, because I was mentioning that your foot structure is starting to become, what it's going to be by around the ages of 12 to 15. So if you're 16 years old versus if you're 13 years old, then that certainly makes a difference there too. You want a shoe that fits adequately with that thumb's breadth imprint between the tip of the toe and the front of the shoe, and you certainly don't want it to be bigger than that. Another question, my twins play basketball. Unfortunately, due to the pandemic, they were not on their high school team this year. Sorry, but they still play early in the morning before school at a gym and on the weekends outside, weather permitting. My question is there any brand of sneakers more preferable when playing basketball or running, or should we just get them fitted for orthotics? So basketball shoes tend to be specifically basketball shoes. If you went to Nike, Adidas, New Balance, Brooks, any of them, if there is a basketball sneaker, they tend to give ankle support, which is really a good thing. With that being said, you definitely want ankle support when you're playing basketball, only because with basketball, you're jumping and landing and you're putting a lot of stress on the ankle and the Achilles tendon. So having some good support from shoes is important. So I would encourage a high top if they can tolerate that. And then it just depends in terms of orthotics, getting fitted for orthotics. If they have a flatter foot, if they are an athlete, if they have any predisposition to any ankle problems, any foot problems, then I do think having orthotics and being assessed for orthotics is beneficial. But having the kind of dual support, having a high top and an orthotic is kind of that double whammy, and can really give them extra support and help prevention. Pardon me. There's another question here. I have morning heel pain. Any idea what causes that? 56-year-old female, if that matters, no medical condition. So, in the morning, that's when we tend to experience pain with our first step. And that's because when you're sleeping, everything kind of relaxes and almost contracts. So if you were to just lay down right now or just kind of relax your foot, naturally you're like this, the foot kind of hangs and the heel is kind of up a little bit and the Achilles tendon is shortened. So when you go to take that first step, you will feel pain. As you get walking, things kind of stretch out and then the pain resolves. So it sounds like you're starting to develop some tendinitis That could be the back of the heel, which is the Achilles tendon, or the plantar fascia, which is the bottom of the heel, and those two are connected. And I'd be happy to see you and assess that for you. But stretching in the morning can certainly help with that, because if you stretch before you get out of bed, then when you go to take that first step, you don't have that pulling of the tighter tendons, and that can help with that. Is Bionic shoes good? Yes, Bionic shoes are excellent. So Bionic is a brand that was developed really marketing wise, my understanding is for the flatter foot. And I believe it started out with sandals and flip flops. And they just have really good structure to them and really good arch support. They tend to be best for somebody with a flat foot, but they're just a good structured shoe. And Bionic is a brand I write down on a daily basis, tell my patients about. A lot of female patients, because they have dress shoes and they have some shoes that are wedge shoes or heeled shoes, and Bionic is an excellent brand. I definitely recommend it. They do sell Bionic at DSW. You can get it online, but I encourage you to, go in person and try those out. Following on the basketball question, do you recommend special shoes for playing tennis? They're hard to find. I agree with that. There are tennis shoes, and so specifically for playing tennis, that I would recommend. But a lot of times, if you look at, say, if you went to like Adidas, the Adidas website, and you looked at their specific tennis shoes, they're very structurally similar to a good walking shoe. When you play tennis, there's a lot of that back and forth pivoting. So what's really important when you're a tennis player is you don't want to have shoes that are too big. You certainly don't want shoes that are too tight. But because of the nature of playing tennis, if your shoes are too big, it definitely causes a lot of sliding, and it causes the toes to butt and hit the front of the shoe, and it causes some ankle instability. So Adidas has some excellent tennis-specific shoes within their line. So does Nike. Nike tends to be more narrow, like I said, but I would encourage you, I don't know if you've looked at Adidas, but Adidas does have specifically some good tennis-specific shoes. My son is 11 years old and complains about foot pain after he plays sports. Is that something he should get looked at, or could it be that he just has the wrong type of shoe? It really could be that, but I would encourage, getting that looked at, because if he's having pain after sports, there's a really good chance that that could start to translate to during sports or, the following day. And that's just because the way that everything's connected, the way that our tendons are connected, our joints are connected, it's just important just to kind of get an assessment overall. So anytime anybody's having any pain, whether it's during or after a sport or just in the morning, I definitely encourage you to come in and get looked at. It is important not just to look at somebody from the outside, but it's also really important to get an x-ray so that you can see somebody's bone structure. And especially in younger kids, you can see, developmentally how their bones are progressing, how their joints are progressing. I do find a lot of younger kids, especially boys, who play soccer, who play football, basketball, even get heel pain. And that's a topic for another lecture. But when patients still have growth plates, when kids still have growth plates, they're just there, and you're playing like a sport where you're running and moving and pivoting, you can get inflammation within the growth plate. And that's something specific to kids. So I would encourage you to have them come in and get checked out. Is it better to keep feet elevated in the night when going to sleep? It is, that's certainly helpful. I would say that almost always for everybody, just because of of gravity, and if you think about it, in the morning is when you're going to have the least amount of swelling, because you were laying pretty flat throughout the night, your legs weren't hanging down. So keeping them elevated in the night can be helpful, but really what I think is the most helpful is compression and putting it on in the morning. So a sports compression sock is something that I recommend, again, on a daily basis, because you don't necessarily need the compression just for the swelling aspect, but a good compression sock, especially in an athlete or really in anybody, can give support to the muscles and can take stress off of the muscles as well. So it not only provides support of the veins, which cause swelling, but it also supports the muscles and the joints. So I would encourage a sports compression sock and putting it on first thing in the morning, because once you put those legs down, blood rushes down there, and that's when edema sets in. And thank you to everybody for saying thank you. I really appreciate it. I think that's it.
Hi, Dr. Collins. Yep, it looks like you answered all the questions, and you also got a lot of thank yous in the chat and the Q&A. So thank you so much for volunteering your time to educate us on this topic. It was a very popular topic, so you will likely be giving it again in the future.
Yeah, I would love to and elaborate on it too. My mistake.
And again, feel free to email me at programs@mbortho.com if you think of any other further questions that you have. We would just want to thank everyone for joining us, and we hope that you all enjoy the rest of your week.